Maybe then move on to the next item, which is a paper from the Chief Nursing Officer, Jane Cummings, on compassion in practice. Jane.
Thank you, Chair. This paper just updates the board on progress with compassion in practice, which, as you will know, we published in last December. We have now done a 1 year on report, which I've circulated, and so people have got copies of that. And I just really wanted to, I suppose, just give a sense of the amount of impact this has had. And when we did the call to action, and we asked people to tell us what they'd been doing around implementation of the 6 C's, which, as you all know, are the values on which we've based compassion in practice. We were overwhelmed with people that came back with stories, that wanted to talk to us about what they'd done, that wanted to describe the impact they'd made, and the document is full of that. Compassion in practice is based on 6 areas of action, and there are actions at national, local, and organisational level. And the report updates on some of the progress that's been made, and I just wanted to pick a couple of highlights. The first one, I think, which is probably the one that's had the most coverage, is the publication of the staffing guidance. We said back in December that we wanted to do that. So on November the 19th, as part of the government's response to Francis Hard Truths, we published the staffing guidance. That was developed in consultation with many people across England and sets 10 expectations. The expectations are for providers and commissioners around how they will approach evidence-based staffing, how they will ensure they've got the right staff in the right place at the right time. And I think has, for the first time ever, set some clear parameters around what people should do. It's also going to be reinforced by work that NICE are going to do, where they're going to look at the international and national evidence, and they will report next July. And we can also report today that we have had £150 million change to the tariff. That's been announced today. That will have an impact on hospitals to help them ensure that patients can be treated with the care and compassion they need, to help enable them to respond to those recommendations. Clearly has an impact.
Well, I think we ought to adjourn the...
It's not very often I say something that ends up with that sort of response.
Alarming.
All positive. Yes, exactly. So I think that's been really positive. So one of the major pieces of work that we said we wanted to do, we've done. It's landed reasonably well. It's been well supported, and many people have been asking for this for some time. And the fact that it's now been reinforced with the tariff change, I think, is significant. The other key areas I wanted to mention was picking up what Tim has talked about, being open and transparent, using data very well. We've launched a programme in the north of England where several organisations are now publishing really detailed facts around Never events on a monthly basis. They're looking at infection rates, they're looking at patient experience, staff experience, any untoward incidents, and they're linking that with staffing numbers, etc. And they're publishing it on a monthly basis and doing the patient story. This is what we've heard, this is what we're doing about it. 20 people published on the day of my conference last month, and we are now rolling that out to over 30, and it will potentially roll across England, and it's being done in consultation with CQC and NHS England, and I think that's really positive. We've also published Never events on a quarterly for the first time across the country as a quarterly basis, and again a real work around openness and transparency. CNO conference we held at the end of November. That had over 450 people at it. We had a significant impact in terms of the numbers of speakers there, and I won't go through them because they're listed in the paper. But we had some very positive feedback and a lot of learning that went on, and a lot of sharing. And again, the use of social media was significant. So we trended on both days. For those of you that know about that, we trended on both days. We had something like 10,200 tweets over those 2 days, and over nearly 25 million impressions on Twitter. So, and we reached a lot, and we live web streamed all the plenary sessions. So not only was it open to people the 400 plus people in the audience, but actually we live web streamed to people that were able to watch the plenaries, which was really important. So in terms of priorities for the coming year, I suppose from my point of view, there are a couple of key ones. One is to finish to move into the second year of the 3-year strategy. The second is to really embed the 6 C's, not just in the nursing, midwifery and care staff profession, but across everybody. And one of the things that's become increasingly apparent as I've been going around the country is that lots of people are asking to do it. So I've got CCG leaders saying, how can we use this in our own organisation? Patient groups saying, how can we use this in our organisations? How can we ensure that the 6 Cs are as valid for the porters, cleaners, medical staff, AHPs as it is for nurses and midwives? And so the sort of impact it's had and the social movement that it's creating, I think, is significant, and one that we're certainly encouraging. And then the second area is to really embed this in places like social care homes, residential homes. Throughout the NHS, it's pretty well known. But what we want to do now is embed it in the whole health and social care settings, which I think will have a significant impact. So I'll stop there for a couple of minutes. We're just going to show a very quick film that we put together where we asked staff to tell us what the 6 Cs and compassionate practice has meant to them. And it just gives you an indication. This is one of about 6 films we've got, but it just gives an indication of how it's landed with the profession over the last 12 months.
The implementation of the 6 Cs is something that's embedded in your training and in part of your career, and I think just voicing it now just brings it back to the attention of nurses to remind them of what their actual duty is.
I have the duty of care to my patients, and I always try to do my best, to my best of my knowledge, to try to achieve a gold standard care, and without care I wouldn't be a nurse.
For me, compassion is about being able to put yourself in the person's shoes, and have empathy and understanding about how you would feel if you were in their place.
Competency is having the skills, having the knowledge, having the know-how, and being able to apply those in practice.
Communication is an essential part of practice. We have to be very skilled communicators with our patients, with our colleagues, and with the public.
Courage for me is very much, in relation to patients, is very much linked to being an advocate for patients. Always remembering who they are and what they need, and being a mouthpiece for them when they're not able to do it.
Commitment isn't about just turning up on a Monday, finishing at 5 o'clock on a Friday. It's about giving 100%, and it's about ensuring that what you're giving is what you would want to receive back as well, so that the level of care that we're giving is exactly the same as what we would want, and it's being dedicated.
I think the 6 Cs are going to be a massive success. Even if you look at the last year, everybody talks about it now. I think it's a really important tool that us as nurses and student nurses can use to say, I should be doing all these 6 Cs. If I can't achieve competence or compassion, why can't I do that? And it allows us to put things in place to achieve everything.
It can be very emotional working with people with learning disabilities and with the families, because the families are doing an absolute fabulous job caring for their loved ones, and obviously in very stressful circumstances. Often the person with a learning disability is quite happy, they're very well cared for, and it's the families that have the stress. A gentleman with learning disabilities who had a terminal illness, he'd been diagnosed with stomach cancer, lived with his mum and a brother who also had learning disabilities. Mum was an elderly lady, 82 years old. Eventually, Michael did have to be admitted to the hospice. Mum was going every day to see him, supported to go every day to see him. In the early hours of the morning, the hospice contacted both Mum and myself to say that the end wouldn't be long now. So I went and picked Mum up and the brother, took them to the hospice. Mum stayed with Michael to the end of his life. Then at the end of his life, we needed to help Bowden understand why Michael wouldn't be coming home to the bedroom that they'd shared for 50 years. So we took Bowden in to see Michael. It was a very, very moving story. I felt privileged to be part of it. But for me, what was important with Michael's story was you have to balance things, and me losing a few hours sleep that I could easily catch up on, compared to a mother being empowered to care for a son to the end of life and be with him. There's no comparison. I wouldn't swap it. It's an absolutely fabulous job. It's not a job, it's a vocation, really.
for developing those 6 C's, because in my view they don't just apply to nurses. They are the basic ingredients of professionalism for everyone that works in the NHS.
I'm absolutely delighted because essentially the 6 C's connote the importance of a cultural shift. And there was one of the speakers in the film referred to courage as being the ability to being an advocate for the patients. And to me that's absolutely critical. And what I would like to know, Jane, is on the back of that, whether you have measures that will help you understand the extent to which staff feel empowered to speak out, because coming out of Francis, coming out of Berwick, that's going to be really important, that if staff actually feel that there is something that they need to call out, that they have that ability, they have the support, and they know that the leadership will actually be willing to accept that in a positive way. And that's going to be a really important part of it really engaging that cultural shift.
It's a really good point. We have got lots of sort of qualitative stuff where we've got examples and stories. What we haven't got is quantitative, and that's actually what we're working on at the moment. We are doing much more work on staff experience. We're implementing the staff FFT, and some of the work that is happening in different organisations, which we are learning from and spreading, is around them having about speaking out safely. So, for example, we had a seminar at the CNO conference, which Helena Donnelly spoke at, and she was one of the whistleblowers from Mid Staffordshire, who now works in Derbyshire as a staff ambassador, and she was there with her chief executive, Stuart, and it was just a fantastic session that was standing room only, where they described how they had worked on a culture and encouraged people to speak up and tell stories and to say if there were problems. And I've got another example of Southampton, where the director of nursing there has almost written a compact with her staff, which says, my compact with you is that I will listen to you, I will respond, I will take action if you come to me. Your compact with me is that you will actually come and tell me if you see things that are going wrong. And so it was interesting that many of the sessions were oversubscribed, but that particular session was significantly oversubscribed in terms of people wanting to listen and learn and to take some of the good practice back.
Can I just add to that? In the staff survey, and we've got 7 years of information on that. Every year we've surveyed the staff, and part of the survey has been these very issues. So we've asked staff, first of all, whether they think that it's that the environment is conducive for them to raise issues, and they've also asked them whether they think that anyone will take any notice of it when they do. So we can track that over a period. And of course, the issue is there's been a significant improvement over the last 7 years. The problem is, of course, there is still a significant group of staff who do not feel that they either can raise issues and that anyone will take notice of them when they do. So that's not to be complacent about it, but I do think we have those measures that we can track.
Thank you. Ed?
Yes, a comment really. I remember when you and I visited University Hospital Birmingham about 4 weeks ago, and we got out of the chief executive's office and went onto the wards and talked to the sister and the matron about the way in which the information coming through about patients, about wards, about the hospital was really being used not as a performance management tool, but actually as part of compassion in practice and the way in which you were getting organisational learning from it. So it'd be very interesting to see how you perceive the development of informatics across the hospital side as supporting compassion in practice rather than perhaps using it as that sort of harder edge performance management tool.
Again, a really, really good point. And we launched very recently the Nurse Technology Fund, specifically for that purpose. And we've got really good examples. Birmingham is one of them, where they use information in a way that enables them to really understand what's happening at an individual patient, individual staff member sort of level, and to take action to improve quality almost before a problem arises. And I think when I spoke to the ward sister, when I visited, that's what she was talking about. It was the ability to be able to preempt and understand what was happening locally and to really take action at the time that was so critical. So I see it as an enabler. It's about enabling people to do their jobs better, rather than as being seen as a sort of performance management tool which inappropriately used. It's about enabling staff to really do the right things, and it actually provides safer care as well. It provides safer care because it allows information to be shared in a way that stops things being missed.
Jane, thank you very much for that. I think I think we all found the video very moving and very powerful evidence of the importance of values in your profession. And this, to me, is about empowering the profession to be true to its values. It's also, I think, important to us as we go through the rest of the business today to remind us that that's what it's about.
Exactly.
It is about patients. Sometimes it's very dry when we look at reams of figures, at institutions, at tariffs, and issues that are going to dominate our discussions for the rest of the day, to forget that this is about putting best resources to the best interests of patients across the NHS. On a matter of formality, we're asked in the paper to note the progress with compassion and practice, which we certainly do. I think, bearing in mind Chief Executive's comments, wanting to track this through the staff survey and to see as the impact as we hope and we're sure will continue to develop. We're also asked to agree the priorities for next year for compassion and practice, which I think comes into our next paper, which is in the planning guidance. And I think the other points from this paper I hope we can pick up as we go into the planning guidance. So may we receive Jane's paper